Good afternoon, everyone. My name is Max Latona, and I am the Executive Director for the Center for Ethics and Society at St. Anselm College. It's my pleasure to welcome all of you to today's program entitled Dover Mental Health Challenges and Response, a conversation with Dover community leaders. Today's program is about a specific challenge that the city of Dover, New Hampshire faces, but it's one that is not unique to Dover, as cities and communities all around the nation are grappling with a similar experience. It's the challenge of how municipalities can best provide mental health crisis intervention and support to their communities. What are the mental health crisis needs of the Dover community? What kinds of resources and services should the city of Dover be providing to individuals experiencing a mental health crisis? What kind of immediate care should be offered? Who should offer it? What kind of education and training, if any, should the care providers be given? What kind of follow-up referrals should happen? Are there various agencies concerned with this problem that are communicating well enough? These and other such questions are questions that the city is grappling with and will be touched on today. To its credit, the city of Dover, with the leadership of the Dover Mental Health Alliance, has decided to address these questions directly. It has already taken some measures to respond to these challenges, and you will hear about some of them today. But the community also understands that further effort may be needed. The city of Dover and the Dover Mental Health Alliance have formed a subcommittee to study the challenge of mental health crisis intervention by city-funded services and to recommend an action plan that might guide the city's policies. The Center for Ethics in Society at St. Anselm College, whose mission is to help communities and organizations in New Hampshire address important ethical issues that they face, is working with this subcommittee to help investigate this mental health response challenge and to develop possible solutions. In a moment, I will introduce our moderator, who will be speaking with some of the leaders of the Dover community who serve on the subcommittee in question. Before I do so, I would like to assure you that today's program is only one important step in the work of this subcommittee. In the coming months, as we continue our study of the challenge of mental health crisis intervention, we will be convening at least 2 additional public conversations in order to inform the Dover community of the subcommittee's progress, as well as to gather feedback along the way. The subcommittee knows that the success of this project will depend very much on community notification, education, input, and feedback. Without further ado, I'd like to introduce our moderator for today's program, who may be already familiar to many of you. Laura Knoy is the founding host of The Exchange, New Hampshire's best known and highly respected statewide call-in program. She stepped down in June of 2021 after 25 years behind the microphone. Laura is well known in New Hampshire for her award-winning in-depth coverage of important issues and is widely regarded for her interviews with presidential hopefuls. Laura is a graduate of Keene High School in New Hampshire, and prior to hosting The Exchange, Laura worked in public radio in Washington, D.C. as a local reporter and announcer for WAMU and as a newscaster for NPR. Before her radio career, she was a researcher for USA Today's Money section and a research assistant at the Institute for International Economics. In 2007, Laura was named New Hampshire Broadcaster of the Year by the New Hampshire Association of Broadcasters. Laura, thank you for joining us today as our moderator, and I now turn the program over to you.
Well, thank you, Max, for that introduction, and I'm glad to be here with all of you. For the next hour, we're going to explore, as Max said, what the community response is now for people experiencing a mental health crisis in Dover. We'll ask what the challenges are and what's working well. And we'll also learn, as Max said, about a new initiative to improve mental health response and how you can help shape those solutions. This afternoon's discussion is just the first of 3 events. And although we're on Zoom today, the next 2 will be in person as well as online. And we will be seeking your input. For this kickoff discussion, we have 4 guests. They are Dover Police Chief William Breault. He's been with the department for almost 25 years, holding every rank, and was appointed chief in 2018. He has a master's in public administration and is a graduate of the FBI's National Academy. Chief Breault, it's great to have you. Thank you for being here.
Thank you, Laura.
Also with us is Christine Boston, Assistant Superintendent for Student Services in the Dover School District, a position she's held since 2018. Christine has also served as the district's Director of Pupil Personnel Services and as a principal of both the high school and the middle school. Welcome, Christine. Good to have you.
Thank you, Laura.
Also joining us is Christopher Kozak, COO of Community Partners, which is the regional provider of mental health, developmental, and family support services. Chris is involved with a variety of efforts to improve mental health response, including the Dover Mental Health Alliance. And Chris, I'm really glad to talk to you.
Thanks for having me. Pleasure to be here.
Also with us is Suzanne Weete, Education and Engagement Manager at Community Partners and a founding member of the Dover Mental Health Alliance. Suzanne is also a youth and teen mental health first aid trainer and a NAMI-NH suicide prevention trainer. Suzanne, it's really been nice to work with you. Thank you for being here.
Thank you, Laura.
Again, before we jump in, a note to you, our audience, we won't be taking your comments live today, but your input will inform our next 2 community meetings and will help shape efforts to improve Dover's mental health response. So as you listen, send your thoughts, your questions, your personal experiences to info@dovermentalhealthalliance.org. Again, that's info@dovermentalhealthalliance.org. Also, this event is being recorded and put on YouTube. You can also find it on the Dover Mental Health Alliance website. So all of you, let's begin and just describe for us, please, what you're seeing today in terms of mental health crises in Dover. And Chief Breault, if you could go first, please.
Sure. Well, again, good afternoon, Laura, and thank you for inviting me to participate today. Specifically to the police department, what we're seeing is over the last several years, and I know it's true for the fire department and emergency services as well, and it certainly isn't just here in the city. It's really throughout the region, throughout the state, and nationally. I think it's a trend that unfortunately is continuing. But we've seen an increase in mental health related police calls for service and fire and EMS calls for service. We know this through our calls for service. And we've also realized that mental health, substance misuse, and homelessness are all somewhat intertwined. So as we, over the last 10 years or so, as we watched our calls for service and the trends for our calls for police services, we've seen an increase in a lot of calls. You know, people don't call the police or don't call the fire department to say, hey, I'm suffering from a mental health crisis. Can you please help me? They present in a whole bunch of different fashions. So it may be domestic violence. It may be a EMS call that somebody has a medical aid issue, when in reality, the underlying issue is their mental health. So there are certain calls that we track over time that really show us that there is a direct correlation to mental health, homelessness, and substance misuse. And for us, those are calls such as well-being checks, assistance calls, non-criminal calls in nature. We've seen over the last 10 years a 207% increase in well-being checks. Those are times where either an officer directly observes somebody, or we get a call about somebody's welfare. Somebody just isn't acting appropriately or the way they should be. They don't call in necessarily a crime, but an officer is dispatched to go and check on that person. So we've seen a 200% and 7% increase there.
Wow, that's huge. Yeah, go ahead, Chief Breault. Yeah.
We've seen an 85% increase in suicidal subjects over the last 10 years and a 285% increase in trespassing and vagrancy. So obviously, most of these are non-criminal calls in nature, but they're really driving the increase in calls for service that we're seeing. So we're definitely seeing, this is putting more of a strain and more of a tax on not just police services, but fire services, our local emergency rooms, and that increase seems to be continuing. So we really need to take a look at how can we better respond to those things.
Wow, I had expected you would say, Chief Breaux, that calls were up, but I had no idea it was by that much. That's striking, and we'll probably return to some of the themes that you just raised there in a moment. But Chris Kozak, you too, what types of situations is your organization responding to? I just want to give our audience a sense of what you all are dealing with in Dover.
I mean, I think Chief Breaux kind of covered, what we're seeing. We see it in a different way. So they get called out from a law enforcement perspective. We're seeing those kind of calls come in when it is more readily identified as a mental health issue or mental health crisis. And so, I'll go back to 2010-ish. Was about one of the last years where the system worked somewhat normally. So whether somebody went to the emergency room on their own or police fire brought them there due to a mental health issue, we could be called in and we would do an assessment, and if necessary, somebody kind of went right from there to the hospital. And I think we've all seen the news headlines from that point forward, where we still have people boarding emergency rooms awaiting services. So we'll talk more a little bit later about our new program that started on the first of the year for a mobile crisis across the state and an access point. I don't want to spoil that for everybody, but those are the types of services that, or the types of calls and concerns that we get involved in from a crisis standpoint.
What types of mental health issues are you seeing people have, Chris? What sorts of crises are you responding to?
So, since the pandemic, we're seeing a lot more calls related to general anxiety and depression. I think the amount of isolation that people have experienced and the disconnectedness from their friends, family, community has really been driving an increase in that type of activity. Previously in the adult space, we're the community mental health center. And so we would be getting involved with people with, more of a severe mental illness. So maybe somebody with that's experiencing a thought disorder or other types of impairments in thinking that way. And we're still getting those, but the influx of people just needing and wanting services and not having other outlets, we're getting a lot of phone calls, and it's kids, it's kids' parents. It's really across any age group right now where the pandemic has really taken its toll on people, and they're reaching out for services.
I'm glad you mentioned that. Yeah,
it's been good. It's kind of brought to light that mental health is not it's not something to be afraid of, and it's not something that should be feel shame around. It's real, and it can happen to anybody at any time. And I think the pandemic's kind of put a spotlight on that.
Well, Christine Boston, I do want to turn to you too. And I'm guessing the pandemic has had an impact on the mental health situations that you're seeing with the kids in the schools. Just give us that broad description, if you could, Christine, of what you're seeing in terms of mental health in Dover's school system today.
We're seeing exactly what Chief Breaux described, except we're seeing it in younger people. So our need for mental health and substance misuse services have doubled at the midpoint of this year from last year. So we'll see what that number
that's
is
a
at the
lot.
end of last year. It is. We're seeing an increase in parent referrals for students to get mental health services in school, student self-referrals, suicidal ideations. This year alone, in our high school population, we've had 29 students hospitalized for mental health supports. At any given point in time, I have a student in the emergency room waiting for a bed. And I think that's a remarkable thing to think about, that our kids are spending 7 to 10 days in the emergency room before they can access a hospital bed. And we're seeing it in younger students. I've been with the district 14 years. When I started, I don't recall suicidal ideation in kids under 5th or 6th grade, and now we're seeing them at the elementary level. So the intensity and severity has just really increased since returning from the pandemic.
Wow, that's so sad. Little kids, Christine. And Suzanne, your broad thoughts on the mental health picture in your community. And Others have talked about how it's changed. So if you want to refer to how it's changed as well, that's great.
Forgot to unmute myself. And it's going to be a little bit of a different twist from what Bill and Chief Breault and Chris talked about, because our community over the last several years, we've experienced some really difficult mental health related circumstances and challenges. It's even before the pandemic. I mean, I keep saying it's taken the pandemic to really open up our eyes to mental health challenges, but it was really well before that. But the way I'm going to look at it is that these challenges and the effects of the pandemic, they've really catapulted the desire within this community to come together and address these mental health challenges through education, awareness, stigma elimination, and suicide prevention. So Christine and Chief Breault and Chris, they're seeing it because they're right on the front lines working with clients and patients. My take is on the community level that we have hundreds of community members who live and work in Dover and surrounding towns that are taking action. They're becoming educated. They're starting to normalize these conversations about mental health, about suicide prevention, about stigma. And I'm really proud of the work that's being done here, and also hopeful for our community in becoming the best and healthiest version of itself. It's not going to happen overnight. The work will take time, but this sense of shared responsibility within the community and these common goals among the leaders you see here on the panel, as well as others that are not with us today on the panel. But this shared responsibility within the community, I think over time our culture will change. It's going to take some time, but I really believe that we're on the right path for really creating more of a more mental health friendly community.
Well, and that's part of what we're doing today is, this initiative to make the response even more robust and open up the conversation, as you said, Suzanne. So I'm glad you said that. Before we move on to what the city needs and what you need to better serve people who are having mental health crises, I just want to paint a broader picture again for people who are not involved in this day-to-day as you all are. And Christine Boston, to you first, please. What do you want the people of Dover to understand about the mental health situation in their city?
I think the most common misunderstanding about the school district and schools and mental health is that school counselors it's not within their scope of practice to provide long-term mental health care. So they will do academic counseling, career counseling, some personal goals counseling, but it's not within their role to do long-term counseling. So when we think about the students that I talked about coming in with the need they have, we need to be able to refer them up and out very often, and often those resources don't exist. And I think people see counselor as part of the title and assume this person is able to do long-term mental health counseling, and that's just not the case.
What do the schools provide for a student right now, Christine, who is having a mental health challenge? So you're quite right. The school counselor is more academic and so forth. But what does the school system offer for kids in a mental health crisis?
Sure. So we will do some short-term counseling. We will pick that up until we can find someone to support the student. We do have school psychologists. We will do risk assessments to see, is this something we can work within the school? Do we need to partner with the emergency department or community mental health agency for the benefit of the student? We do more basic things within the school to improve climate and culture, because we know probably 85% of our students respond well to that, and we can keep them from bumping up into higher tiers of need. But sometimes that's just not enough. But there are some basic services they can access at school and do. We have in the past had community mental health providers come into the school and provide services during the day. We haven't been able to do that this year, but we are looking to re-engage with that for the next school year and be able to offer that as a service to our kids and our families.
Chief Breault, I know you have some thoughts about this. What misconceptions are you bumping up against when it comes to the mental health crisis response in Dover?
Well, the frustrating thing for me is the kind of the lack of understanding that many in the community have about mental health. First, the lack of an understanding that the mental health does not discriminate, right? So it happens across the community. It happens to different people from different backgrounds, people from different socioeconomic backgrounds, different races, different sexes. It certainly doesn't discriminate, and it happens across the community. But specifically for law enforcement, what frustrates us, or me in particular, is that we're constantly fighting the national narrative that we've heard about law enforcement over the last several years. And I'm not defending any police agency or police officer that did anything wrong over the last few years, but that is carried over, and all police departments have unfortunately been kind of lumped in together. And the misunderstanding is that the police are often ill-equipped and not properly trained to handle mental health calls, and that certainly isn't the case here at Dover. We put a lot of time and energy and effort into making sure our officers are trained. There's also a lack of an understanding about the level of compassion and empathy that our officers show. We hire officers specifically that are compassionate and empathetic, and it's part of our culture here. And the misperception that the police will make things worse, and that really, in my opinion, couldn't be any further from the truth. And that's supported by our really low use of force incidents in these types of calls. Our officers are trained in de-escalation and in crisis intervention, and they really do a good job. They do a tremendous job, really, in helping people through a crisis. So that is one of the big misconceptions that we face, is just that kind of stigma that unfortunately is currently associated with law enforcement right now, that we're using force unnecessarily, that we're not in a position where we shouldn't be trying to help people. I agree that we're not social workers, we're not mental health professionals, but unfortunately the way the system is designed right now, on a 24-hour basis, there's often nobody else to call. You call 911 at 2 in the morning, and up until January of the beginning of this year, your only options are the police department, fire department, or a local emergency room, because we're the ones available to assist. Is that ideal? No. But I think here in Dover, we've done things to make sure that our officers certainly aren't making anybody's situation worse. We're trying to provide the best help we can, understanding that help is limited, but certainly being able to get them through that crisis, to keep them safe.
Oh, that's interesting. So talk a little bit more, Chief Breault, about that negative national narrative about police right now that you mentioned. How does that negative perception affect people experiencing a mental health crisis in Dover? Are you saying that they might have a loved one who's suicidal, but they're afraid to call you because they're afraid that you might not respond the right way? Is that what you're saying there?
We've certainly had that. We've had people just really not understanding what was going to happen. They unfortunately, people see things in the media, and what's in the media is those really negative interactions, where things went poorly. And again, I'm not defending any police department where that has happened, but that is often what's believed here, because people see it on the media and they're not sure how the police department's going to react. People often think that our sole responsibility is to enforce the law. So they may be concerned about, there may be drug use involved or other things that are, technically illegal, and that's all the police are going to focus on it. And the reality is that isn't the case. Often we try to focus on getting people help before we deal with enforcing the law. So we understand that priority. We try to understand the motivations for people's behavior. We have things in place here like a diversion program where we won't charge people for certain low-level offenses if their crime is motivated by a mental health related issue or a substance misuse issue, and offer them an assessment to get them on the path to getting assistance. So
it's interesting.
It is a frustration that we face, but one that we really have to work harder to overcome.
Chris Kozak, add in, please. What's a myth or a misunderstanding that you find yourself just debunking all the time?
I think from the myth standpoint, you hear mental illness and people will go to Hollywood and the depiction that they've created of what somebody who has a mental illness looks like and how they act. And, unfortunately, there are enough live real events that occur that reinforce that. But the reality is, we're serving, 1,300 plus people annually. And that's not our experience, right? That's not what we're seeing. That's not how people behave universally. And you can have a mental illness. You can certainly have challenges. You can have those demons in your mind. But it doesn't change. It doesn't change your worthiness as a person and your ability to contribute to the community. Yet, we will collectively become frightened and put that narrative in front of it, and rather than seeking to understand or help, we'll cross the street to avoid walking near them. And we need to get to a point where a mental illness is viewed as an illness, and as you may hold the door or help somebody who has their arm in a sling or is on crutches, when somebody is clearly having some level of mental distress, we extend that same kind of attempt to help and assist as opposed to avoid. So I think that's probably my biggest pet peeve, if you will, that's out there of things.
Sure, frustration. Yeah.
Yeah, and I also, for Christine and Chief Breault, they've got roles that they do, right? The schools are there to educate, and they shouldn't need to have a host of mental health counselors on staff to deal with things, and the police department shouldn't need to have a bunch of social workers going around with them. And so how do we as a community kind of relate and address this problem so that if you will, there's a little bit of social worker in all of us to kind of ease those burdens across the board.
Wow. Suzanne, I'm sure you want to jump in there, just jumping off of what Chris said, but also just common misunderstandings that you bump into all the time.
Yeah, well, I'm just so happy that Chris mentioned that. I mean, everyone experiences a mental health challenge. 1 in 5 adults, 1 in 5 children at some point in their life. And it could be any one of us on this call at any time. So, mental illness shouldn't have this taboo space in our head in terms of what it looks like, because it could be any one of us. So I appreciate Chris saying that. But one of the things that I would like to say is that there are a lot of efforts and initiatives that are underway to improve access to resources, as well as enhanced and improved policies and procedures and educational efforts in this community. And they've been underway for a long time. And if you're not, completely connected to what's happening in the school or with things like the Dover Mental Health Alliance or things like that, you may or may not know that these things are going on, but they have been happening here for quite some time. And it takes time to have things kind of roll out and be effective in the community. But some of these efforts aren't even known to the public. There's in-depth crisis pre- and post-prevention protocols that are happening in place in schools with our first responders. There are community members, hundreds of community members who want to be part of the solution, who are becoming educated about what mental illness is and when it isn't, and starting to talk their own stories. And that's part of the challenge is we have to eliminate stigma. And the way you do that is you continue to talk about it out loud, because mental health challenges or mental illness is what Chris said, it's a health issue. It's basically, that's all it is. It's a health issue, really, and that's how I feel about it. What I would like to underscore, though, is that the schools, the hospitals, the community mental health center, our first responders, we cannot do this work alone in terms of understanding what mental health challenges are and what mental illness is and suicide prevention. Not one single entity can do this alone. It has to be an accepted and a shared responsibility of our community as a whole. And this really is a public health approach to changing our attitude and perceptions about mental health and mental illness.
Well, and as you say, talking about it, that's exactly what we're doing as part of this series, kicking it off today. I want to remind our audience that this conversation right now is just the first of 3, examining mental health response in Dover. Our next 2 events will be both online and in person. So please stay tuned for more details on that. Also, while we're not taking your comments live today, we do want to hear from you. Email us to shape our next 2 discussions and help us understand how Dover might improve its support for people suffering mental health crises. We welcome your thoughts, your questions, your personal experiences, at info@dovermentalhealthalliance.org. Again, email info@dovermentalhealthalliance.org. Right now, we're talking with Chris Kozak, COO of Community Partners. That's the regional provider of mental health services. Also, Suzanne Weete, Education and Engagement Manager at Community Partners, along with Dover Police Chief William Breault and Dover Assistant Superintendent for Student Services, Christine Boston. Chris, to you first, I think, but also I want to hear from others. What's the range of responses that happens right now in Dover when someone experiences a mental health crisis?
So right now, Chief Breault alluded to this, since January, we kind of have a new option in the state, which is an access point. And I'll talk more about that. It offers what we haven't had before. I think a couple of people have mentioned the limitations around getting in and number of providers available. And so the access point allows anyone in the community across the state, for that matter, to call a number and get an immediate response from a master's level clinician who will, talk with them about what is the immediate stressor or concern that they're having. And if they are able to manage them and work with them with the safety plan in place at that time, we will typically get a referral from them that we will follow up with within 24 hours and see somebody. And we're able to follow them for up to 30 days. So it kind of has opened doors that haven't been there historically in the state and definitely not in our region. If the person needs an immediate assessment in terms of what's going on or more hands-on, then that access point has the ability to dispatch one of the mobile crisis teams across the state. And we will come out and do a face-to-face assessment and some stabilization services along with continued follow-up services. So I think that's been a game changer. We still have underneath that things that have been here. So 911 still exists. As Chief Breault has mentioned, that they continue to get phone calls. And we also, people still continue to find their way to the emergency room. And so we really haven't, despite the line coming up on January 1st, we've not really seen a significant drop off in emergency room activity as a result of that. So I think it's going to take some time for this to catch hold and work through as we transition. But it is nice to have that option available for us that we haven't had before.
So you're talking about what some people might be familiar with, Chris, the mobile crisis unit. If someone is having a mental health crisis, instead of going to the emergency room or calling 911, there's now another place where they can reach out and get a trained professional on the phone who maybe can help them, I don't want to say de-escalate, but sort of figure out what the next step should be. Is that what you're saying, Chris?
Yeah, I mean, it's both. It may be de-escalation, or it may be figuring out what the next steps are going to be. So either one of those are possible. And if they are not able to de-escalate, or they're not certain about the ability to maintain safety until they can get an appointment, then they'll dispatch a team to go out, and that team will then be there.
So that's a positive development, though, right, Chris? These mobile crisis units can sometimes prevent people from going to the ER.
Yes, that's the goal. We're 3.5 months into this. Most of our dispatches at this point have not been of that flavor yet. That doesn't mean that they haven't been worthy of being dispatched for us. But we're not quite seeing that diversion yet. Like I'm saying, we're still seeing people hitting the emergency room on their own. So ideally, we will be able to do that kind of intervention in the community. But I think people are getting connected sooner than they would otherwise through this number. So even if it's not hospital diversion, I want to make sure people understand that it's not just a hospital diversion, but we understand that there's limited resources in the community. And so I think to get involved and intervene earlier, whether or not this is, should I go to the hospital or not kind of level, I think just that outreach earlier on in whatever's going on in your life at the time is beneficial for us to start working with you and try and ultimately prevent that hospitalization that may be downstream if it's not today.
Chief Breault, what are you seeing in terms of the typical response in Dover to someone in a mental health crisis? It sounds like there's been some evolution there.
There has been, and I think there's been a few things that have happened just in the last few months. Prior to January, really our only option was the officers would respond and determine if somebody needed emergency treatment, regardless of the time of day. Our only option was to bring them to the emergency room. So the mobile crisis response team is also a resource for us to use when somebody's in crisis or needs more assistance, but maybe not to that level where the officer feels like I need to bring this person to the emergency room right now. We can contact the mobile crisis response team and ask them to come out and assist us on scene. But the other big thing that we've done here in Dover is in February, the police department hired and started a new program. We hired a police social worker, a woman who has a master's in social work. She does not respond to calls for service with officers. Instead, what she does is she tries to help people after a crisis get to the appropriate services. So when we were really looking at, where were we falling short? In my opinion, we were falling short in seeing the same people over and over again. So the officers would respond to somebody in crisis, help them through that crisis, make referrals, either take them to the emergency room or just give them referral information. And then 2 or 3 or 4 days later, we're seeing the same person and we're doing it again. And that cycle will just continue. So it became apparent to us that really the best point is to intervene between crises. Again, our officers do a great job in de-escalating people and helping them through that crisis. But where we were falling short is, not really doing a great job in making sure people were connected with the referrals that we were trying to connect them with. So the role of the social worker is just that. When a person's not in crisis, reaching out to that person, or reaching out to that person's family, and helping them get connected with the right resources. So she's working on developing relationships with all the social service providers in the area. And she can help people kind of figure out who might be the best social service agency to connect with. But she also has an understanding of limitations, the waiting lists that are going on. So it may be the person would best be referred to a certain agency, but understanding that agency's waiting list and that agency's the issues surrounding getting somebody into treatment with that agency, she may be able to kind of push them in a different direction. And I think that's important to understand, because often when we do that, if we said to somebody, hey, call community partners, and community partners might say, well, we have a waiting list and it may be X number of months before we can get you in for an appointment, they may stop right there, right, and then not seek help. So we're trying to, we might not address their primary concern, but often what we're seeing is people that we deal with have multiple concerns that need to be addressed. So pointing them in that right direction, or helping family members. One of the cases was a homeless woman who also had some mental health needs. And the social worker was able to get her into a temporary shelter and get her on a waiting list for a more permanent shelter, also establish some mental health treatment for her. But what we realized, it was a really pretty simple thing, but to get on the waiting list for this long-term shelter, you needed to have internet access, you needed to download a form, fill it out, and send it back to them. Well, the woman had no access to
Yeah,
any of
she's
that.
not going to be able to do that, right?
Right. So,
Yeah.
So it's just a simple, thing to get people beyond those obstacles that are not intentionally set up, but they're there.
Sure.
And it's also a warm handoff to other agencies, right? So, when our social worker calls somebody from community partners that they have a relationship, we're more likely to get a better result, right? Because anytime you have a specific advocate advocating for you, you're more likely to follow through with those services. So that's really what we're hoping happens here.
That's really interesting, Chief Breault, and I want to bring Christine into this as well. But do most police departments in New Hampshire have a social worker? I find that really interesting and innovative, because you do hear police often say, more and more we're having to act as social workers. Is this relatively rare for police departments to have social workers, or is this a trend that you're seeing elsewhere?
It's a trend that's starting to catch on across the nation, but it is still extremely rare. particularly in the model that we're using. There are particularly a lot of the larger police departments, New York City, Boston, San Diego, where they have social workers really embedded with officers that respond. We're a large city for the state of New Hampshire, but we're still not large enough to really identify. For us to do that, we would need several social workers in basically every patrol car out there.
Yeah.
So this allows us, I think, to help a wider spectrum of people in a more timely fashion than just embedding them with police officers. But again, we didn't see the issue as at time of response. We saw where we were falling short is connecting people to those services. And the goal is really, hopefully, if we connect people with those services, we won't see them again and again and again. So ultimately, we will remove the police department from that cycle.
Right. Well, and Christine, you talked earlier about just the alarming rise in mental health struggles that kids are having in the Dover schools, even little kids. Given those increases, how have you changed your approach, Christine, toward a mental health situation as you adapt to the changes you've seen in your communities, in your community over the years?
We've definitely tried to increase our in-school based services so that the point of access is quicker and sometimes easier for a family. If they can access services in school, it doesn't mean time off from work for a parent, or if there's transportation issues, those are negated. We do more risk assessments in school where we're determining, what is the veracity of a suicidal ideation? What do we need to do with that? Is that something we can work with a family? Do we need to refer to the ED emergency department or someone else? We've also developed critical incident teams, which provide behavioral health services to staff and students when something has happened, whether it's a natural disaster or the death of a staff member or something like that. These teams will go in with the assistance of the state of New Hampshire disaster behavioral health team to support people in that moment so that smaller things don't get bigger for these students and staff experiencing some type of loss or issue like that. So we've really tried to, within the confines of a school, and our primary goal is education, to provide more during the school hours than we have before to ease some of the pressure on outside services, leaving those available for really the top tier of need.
It's interesting. Before we began this program today, you and the chief were talking about budget season in Dover. When you present the school budget, Christine, and you make the case for more mental health services in the schools, what's the reception to that message? Do people in general understand that the schools need to provide these services?
I think there is a good understanding of that. I think the challenge is the way that public services, public schools are funded is very much attached to the roof over people's heads. And there's a reality to that of what people can afford to spend on property tax. So it's always a delicate dance of what can we ask of our community members financially and what can we reasonably provide with what has been provided to us.
Well, in a few minutes, I'm going to ask all of you one of the big questions that we're focusing on with this series, which is, what will it take for Dover's mental health system to be even better, for that response to be even better? But before we do, it's always good to be positive as well. And so I did want to start with you, Suzanne, but ask everybody, what's been working well with all these efforts that the four of you have been describing? What's been working well, Suzanne? What feels like positive change to you?
Just what I was saying earlier, people are really starting to talk out loud about their own mental health challenges because, again, we all have these, right? Over time, sometime in our life. I talk to my kids about it. They sit at the dinner table and roll their eyes at me now because I'm talking about it all the time. But, people if you get help earlier, so during a challenge, that's great because you don't want it to roll into a crisis because then it's more difficult to solve that problem or that health issue. So, taking a look at these things as a health issue, where, it's okay to ask for help. It's okay to do, to call the doctor. It's okay to talk to somebody about this because it's really just a health challenge. But what I would like to say is, when Dr. Harvard and I, the superintendent of schools, we launched a school and community-based work regarding mental health education. It ultimately resulted in the formation of what we call the Dover Mental Health Alliance. And for not even being any sort of entity, what I really think is great is this community is so interested in doing something about mental health in our community. And I've had an overwhelming response of people that want to be involved. And I'll tell you, the majority of people that are doing a lot of the work of this alliance are volunteering because they understand that this work is really, really important. The Dover Mental Health Alliance is really, it's for those who might not know, is a community-driven grassroots coalition. The mission is to build a resilient community that is educated, responsive, and conscious of the impact of mental health and mental illness. And so what we're doing is we're connecting community members with mental health education, suicide prevention, normalizing the conversation. And today's event is just one of the initiatives of the Alliance. So I'm really thankful for today, and also to have a strong partnership with the police department, obviously the school district, our healthcare providers, because it takes a village to make this work happen. And we have to start upstream with prevention. So hopefully the number, we don't roll into continued crises and crises and crises.
Sure. Yeah. And towards the end of our program today, I definitely want to give you an opportunity, Suzanne, to talk more about the Dover Mental Health Alliance and this initiative that we're all involved in. But Chris Kozak, any success stories that you care to share?
We do have some. Before I jump to that, I just want to add on to Suzanne. Dover has, I don't know what's going on completely in every community across the state, but Dover stands out. The Mental Health Alliance definitely, but the schools have introduced teen mental health first aid, which is not in, that's an undertaking that it involves changes to curricula and everything. Chief Rose started a community engagement group. The city is partially, they're behind the funding of this whole session and kind of putting this together and understanding the response. So kudos to Dover overall in this response and what's going on and kind of taking this issue that nobody really wants to talk about it, but bringing it right up to the forefront and making it a community discussion.
And if I can add, Laura, too, just to
Sure.
what Chris is saying, in the high school, students have formed their own mental health initiative. They went to the administration and said, we want to change the culture in our school, in the high school, because we want to be able to support our peers. We want to be able to bring education, mental health education to our peers and to our community. We want to be part of the solution. And so from a group of 5 people last summer, it's up to probably 35 kids now and growing, where these kids want to be part of their school community to help their peers get through challenges, because kids know what's going on. Kids all know what's going on with the other kids, more so than the adults do. And so what better way to have that peer support? And they also, they're really, really proud and happy and want to continue this work for that school culture, which is really, really exciting.
Yeah, Christine, so that leads perfectly into you. What positive changes or success stories have you seen already through Dover's efforts to improve its mental health response?
I would say, right at the top of my list was what Suzanne was speaking about, the student-led mental health initiative at the high school. We now have 35 students who are trained to train other peers in suicide awareness and recognition. I would also say the NAMI New Hampshire suicide prevention training. We now have a cadre of 17 adults in the community, from the police department, the schools, community partners, interested community members, the Rotary, who are training other adults, and we run those trainings once a month, and they are always full, and it's fantastic. And I would say really at the top of all that has been the partnership with the Dover Mental Health Alliance. That has made the biggest difference for us as a school to be able to engage the community and not do this work alone, because our kids are out there the other hours of the day that they're not with us, and to really be able to wrap around kids and speak the same language around these things, it's making a huge difference.
I want to remind our audience that if you're just joining us, welcome. Today's program is the first in a series of events on Dover's mental health response, including a new initiative for improvement. We've been talking with Chris Kozak, COO of Community Partners. That's the regional provider of mental health services. Also, Suzanne Weete, Education and Engagement Manager at Community Partners, along with Dover Police Chief William Breault and Dover Assistant Superintendent Christine Boston. We want your input too, your experiences with the mental health system, and your thoughts about what would make it better. Send us an email, help us shape our next discussions, and help us understand how Dover might improve its support for those suffering mental health crises. The address is info@dovermentalhealthalliance.org. Again, that's info@dovermentalhealthalliance.org. And stay tuned for our upcoming in-person events in May and June. Those will be in person in Dover as well as online. Event details will be posted at the Dover Mental Health Alliance website. So here's a question that I want to get everybody on, a key question that we'll be examining in this series. Chief Breault, I am going to start with you, but go down the line. How could the mental health response system in Dover be better? Go ahead, Chief Breault.
Well, I think doing exactly what we're doing today, there needs to be more of a community understanding of mental health and how it impacts everybody. But also an understanding, and I know we've all said this already, but it isn't going to be accomplished by any one of us or any one organization. It really is going to take partnerships between the city, between social service organizations, and a commitment from community members to really make a change. We need, I think Suzanne used the term culture, and I think we really need that cultural shift to people to understand it and to prioritize it. But I also think, mental health isn't just a single person's issue. It affects everybody, right? So it affects family members, it affects employers, it impacts the schools, as we've talked about. It's a community-wide problem. It isn't just the person that is suffering from the mental health issue. We need to understand that, and I think as we move forward, there's certainly things that we need to do. We need to increase the next level of services. I think that's a big challenge that I think we all see. We can all have the best intentions to get people help, but there needs to be that level of help to bring people to. So understanding the limitations of the system that we work in, how do we, I guess, maximize our opportunities there, but also understanding that there really needs to be an investment, whether it's locally or through the state or even nationally, to really improve that next level of services.
When you say services, Chief Breault, do you mean basically mental health counseling, support, substance abuse services? Give us a little more there, please.
Really, all of the above. Right, whether it's community-based counseling services or, in the extreme cases, hospitalization, the fact that people have to wait in emergency rooms because there simply isn't enough hospital beds at the state hospital to handle their mental health needs, I think is exactly what I'm talking about. We need to do better. We shouldn't be putting people in emergency rooms for 2 weeks because there's a lack of services, or there's such limited services that we've overwhelmed them. We just can't keep up with the demand for services. So to answer your question, all of those things need to increase. It certainly isn't just mental health. We're seeing it with substance misuse. We're seeing it with homelessness, and often all three of these those things kind of are intertwined. People that are homeless often have either a mental health issue or substance misuse issue, and conversely, the other things impact them. So we need to see an increase across the board, but we also need to, we can't wait for that to happen. We need to figure out a way to work the best in the system that we have now. So things like our social worker, there is help out there. I don't want to lead people to believe that the system's broken. If you're suffering from a mental health issue, please reach out. There is help. People do want to help you. There are organizations that can help you. We can help you. We will help put you in the right direction. But I think to really, make any headway in the crisis, we really need to look at more long-term, what are those second level services, and how do we increase those as well?
Oh, that's interesting, and lots for us to tackle. Wow. Maybe in our next conversation, we can focus more in that, like short-term, long-term, but let's touch on it a little bit more. And Chris, I want to turn to you. So sort of short term, what does Dover need to improve mental health response? And then long term, I'm guessing you agree with Chief Breault, we need more mental health providers, substance abuse providers, and so forth. Go ahead, Chris.
Yeah, I totally agree with Chief Breault. I also want to introduce into this equation, and it's relatively new for us, and it's relatively new for the state, but the use of peer supports is really, I think, gaining traction. And I know that we have had them for a few years now, just on our ACT team, that's the Assertive Community Treatment Team. But with the start of the mobile crisis team, we've added some additional peers to our program. And I have seen and I also hear their stories, and they are able to make a more immediate connection. There isn't a hierarchy or any perceived difference. They get to approach people and share their stories, and that makes all the difference. I was at a meeting up with Rochester Schools maybe a week, 2 weeks ago, and one of their students had reached out to the access point, and we got deployed, and the student just made this instant connection to our peer, and are able to help them move forward probably quicker than the whole therapeutic alliance. And I'm not trying to dismiss or diminish at all the value of therapy, but that takes a little bit more time to start building that relationship and getting into some deeper things. Whereas the relationship with the peer, you can share those stories more fluidly. And so I think Suzanne made the comment, and maybe others, if we're all honest with each other, we've all had some level of a mental illness or mental distress, because it's part of life. And when it becomes debilitating, it becomes an illness. Otherwise, it's part of what life is. If you don't experience that flux between highs and lows, life is very boring. And so understanding that and understanding in some respects we could all be a peer expands that pool of resources for us to tap into as a community. And it's not we always have to go to a therapist, or we always have, but if we could all be honest with ourselves about what's going on, we could all actually serve in that peer role. So I think that's maybe long-term, maybe intermediate, I don't know. I think it's a low-hanging fruit in my head to just be honest with ourselves and put ourselves out there.
Wow. So Christine, to you too, you can address this question of what Dover needs, either short-term or long-term. But go ahead, what would really make an impact in your opinion, Christine?
I think as Chris suggested, being a peer is going to make a huge impact. And again, continuing the work to be willing as adults to have the conversation and to make this a community where students and kids are willing to have the conversation with us and each other is really what's going to have the longest term impact. For a couple of reasons. One, it leads to that peer place, and it doesn't always have to be a therapist. If you get help earlier and more often, or have someone you can talk to, maybe you don't need that second level. But the more we normalize it and talk about it, I've got to believe more people are going to want to go into this field of work. And it's an incredibly rewarding field. And we need more counselors and therapists on that other end as well. So I think it would help in both ways.
Yeah, Chris, you and I have talked about that, that the desperate need for more mental health practitioners. How would you encourage someone who was, either just graduating from high school or college, or maybe making a career change? How would you encourage that person to consider a career in mental health?
I think set a lot of the negative media and press aside around that, and think, what you want to do, where you want to be. And if this is something that is of interest to you, pursue it. There are means now. I think people are used to traditional bricks and mortar, and sometimes that comes at a price, but there are online programs now significantly cheaper and less expensive, so that you can get through a program and actually achieve that goal of becoming a licensed therapist without having a lot of debt. And I think, as Christine said, it's a very rewarding career. And, part of that time will be spent in a mental health center somewhere. If you're in our area, come spend it with us, definitely. Um, but the community needs you, and you'll find that there's a lot more to it than the negative press that comes around it. I sometimes think the mental health system in the state, we put out all of our woes sometimes in editorials and op-eds, and I don't think that helps us, because we're not telling the success stories and the positive stories of the kids who pass through our centers and come out, in a very different place. But it happens. We've got a lot of great stories that come through. It's a great client on the adult side for us that had a great career going and suddenly had his first manic episode and almost lost everything. And he came to us, and he's back now, working. That's more than what happens in the mental health system, and it's a positive experience.
Wow. Well, all of you, as you look at other cities and towns around New Hampshire or New England, I'm wondering, Christine, I'll turn to you first. Are there models that you admire in terms of that community's mental health response?
I would point to Boston Public Schools, and they have a comprehensive behavioral health model. They work with their community allies. They work with Boston Children's, and they've really been able to start from ground zero and build this comprehensive program across all of their schools. And it's a huge district, as you know. So theirs would be one that I would be looking to emulate.
Oh, it's interesting. Chief Breault, other models that you look at in terms of police departments around New Hampshire or New England?
Unfortunately, I think we're all struggling to find ways to better respond to it. It certainly isn't unique to Dover. I really think we're ahead of the curve with the partnerships with Dover Mental Health Alliance, with our partnerships with the schools, with community partners, and with a whole bunch of different organizations. I know we are getting a lot of attention about how we're handling things. I think we have an opportunity to be that model for others to look at with things like our police social worker, how Dover Mental Health Alliance, how we're using a group of citizens and community members to help us shape how we respond, I think is huge. So in a lot of ways, I think we are becoming that community.
Suzanne, to you too, models that you look at, or maybe as Chief Breault says, Dover is becoming the model.
Well, I just want to say, Chief Breault and the police department, you all, in knowing some of the police departments, I tip my hat to you, because you're really a progressive police department, and what you do for your staff and how you handle situations on the streets. So you do a really, really great job. And I'm so happy that we're all on the same page as to what we're trying to do here in the community, because it makes it a lot easier. Same with the school district. And I just have to say, with the Alliance, we are the community engagement arm of community partners. So the fact that we are backed by the Community Mental Health Center of the county is really a huge, huge thing for us to be able to have that backing and support and expertise. Because as you said, Chief, the Alliance is made up of community members, whether it's I'm a mom of 3. I'm not a therapist, but I've worked in nonprofit for many years. But, I think it takes any person in the community that says, I want to make a difference. I want to understand what this is. Get educated about it. Don't be afraid of what mental illness is or what mental health challenges might be, and learn then how to recognize and be able to respond appropriately. Because as Christine and Chris said, it doesn't always need a therapist to actually help someone in need. Right now, because of the pandemic, we're seeing a lot of people that have never had to have help from a therapist before. So that's just really taxing our system. We want these people to get help. But you know what? It could be another trusted adult if they just have a little bit more tools in their toolboxes to actually be able to listen to this person, give them space, allow them to vent and talk. That can actually really, really go a long, long way to helping someone who might be having a mental health challenge and hopefully not develop into a mental health crisis. But I do want to say too, regarding the modeling, and the Dover Mental Health Alliance is, again, made up of volunteers in this community that they're passionate about this work. And now we have Somersworth and Rochester that want to emulate this model in their own unique way with their own cities. But we're starting to do work. We've gone about a year now working in Somersworth to try to emulate this model here. And now Rochester is really, really interested in emulating as well. Again, each town has their own separate and unique systems and needs. But the fact that the idea is the community is ready to take this work on, and they have community members that want to be part of the solution is a really hopeful sign for me that things are moving in the right direction.
Well, and as I've said a couple times, today is just a kickoff to a 3-part series of conversations. The next 2 will be in person and online, part of this broader initiative as Dover seeks to improve its mental health crisis response. And toward that end, I just want to wrap up with everyone. Suzanne, to you first. Just fill in our audience, please, on what this whole sort of new step is all about and what your hopes are for it, Suzanne.
Yeah. So again, the Dover Mental Health Alliance, we are a grassroots coalition dedicated to connecting people to mental health education, awareness, stigma elimination, suicide prevention. And we have lots of different initiatives regarding education and awareness events within the community. This particular thing that we're doing today, this panel is a subgroup of a larger, what we call Dover Mental Health Task Force. And this is comprised of key community stakeholders. Everybody on this panel is on that right now. But they're key community stakeholders across all sectors throughout the city of Dover, like, again, police department, fire department, the mayor, hospital, Wentworth-Douglas Hospital, the Dover schools, SOS Recovery, Community Action Partnership with Stratford County, the Sheriff's Office, Stratford County Public Health Network, the Dover Chamber of Commerce, NAMI, New Hampshire, Recovery Friendly Workplace. These stakeholders from these organizations are coming together, and we are charging this group with improving cross-organizational communication and support, as well as assessing and addressing barriers to care, and improving public perception and increasing awareness and education surrounding mental health. That's really the cornerstone of this DMHA initiative. And this task force of the city's response, the city-funded organizations, has been supported by the city of Dover with some funding so that we can conduct this work to be able to enhance and improve the mental health response for our community. So I'm really thankful for the city of Dover. It's allowed us to contract with the Center for Ethics at St. Anselm's, and it's a big task, but people are really interested in getting this work done and making things better for our community, and that's really the bottom line.
Yeah, Christine, similar question to you. What are your hopes for this initiative?
My hopes are continuing the conversation, drilling down deeper into what's working, what isn't. I think the benefit of Dover is it's not just surface discussion anymore. It's okay, what is it? What can we do about it? How can we change this? So that's really exciting to me to work in a community willing to have that deep level of conversation and commitment to the topic.
All right. And as I said earlier, more conversation to come. How about you, Chris? What do you hope comes out of this sort of next step here?
I'm going to answer that by kind of backing into the other question about models.
Sure.
I think Dover is rapidly becoming the model. And I say that the state of New Hampshire is filled with small towns. As Chief said, Dover is one of the larger towns, Rochester is. But as you look across the country, there are a lot of small towns, and the Cahoots type model in Eugene, Oregon, or some of the other things is not going to be able to run in smaller towns and municipalities. And I think what's going on in Dover, this grassroots movement and people taking an interest, it can be done in any size town, but especially in smaller towns with limited resources. And it can be really tailored to their particular needs and interests at the time. And so Dover, I think, is becoming the model.
Chief Breault, I'll let you have the last word there. Your hopes for moving forward.
Like everybody else, I think it gives us an opportunity to continue to learn how to do things better, understanding what's working, what's not working. Are there better ways to do things? How do we work in the environment that we're forced to work in? And hopefully we can use this to develop an action plan that can guide us over the next several years. So this isn't, the goal of this isn't just to do it and then be done with it. The goal is to develop an action plan that we can actually use to move the city forward, not just this year or next year, but over the next several years.
All right. Well, lots more for us to talk about in our next sessions. That is all the time we have for conversation today. But again, this is just the first in a series of 3 events on Dover's mental health response. And we do want your input, your experiences, your questions, Your thoughts about, as our guests have said, what's working well, and for sure, what might improve the system. Send your email to info@dovermentalhealthalliance.org. Again, that's info@dovermentalhealthalliance.org. And please join us for our next 2 follow-up meetings in May and June. We'll be in person and online. Event details will be posted at the Dover Mental Health Alliance website. I want to thank our panelists, Christine Boston, Chief William Breault, Suzanne Weete, and Chris Kozak. I'd also like to thank the City of Dover, the Dover Mental Health Alliance and its volunteers, and to the Center for Ethics and Society at St. Anselm College for helping to organize this series. Lastly, to you, our audience, thank you for being with us today. I'm Laura Knoy, and I hope you join us again.